Okay, hi everybody. Imogen and I are back for another chat, and we're going to be talking all about lower back pain today. We're going to cover a little bit in terms of acute pain that you might experience, and also general lower back pain, soreness and achiness. So welcome, Imogen. This is a bit like our Christmas
Hello.
special today. Imogen is all dressed up in her Christmas gear, and we're at that time where we think actually this might be a good topic to cover because people are starting to obviously have some time off now. They're going to be thinking about kind of how perhaps worn down they are after a long autumn and going into winter of kind of working and doing different activities, but then having that bit of a break and maybe considering any lifestyle changes, which we'll talk about a little bit in terms of movement and things that you might change based on how you've been feeling, what your goals are for the new year, and hopefully this might be a little bit of a helpful topic. It might be something you can have a think about over the Christmas and New Year period to make some changes come January. Okay, so Imogen's going to start us off today. We're just going to talk about the kind of issues that our clients come to us when it comes to lower back pain, how we deal with it, what kind of advice we give, and anything that we might think is a really good top tip for you guys. So Imogen, I'll pass it over to you to start off.
So with lower back pain, I suppose you kind of like there's sort of two instances almost as like categories you'd sort of see. I see anyway. With terms of like the people coming to you, you either have like the sort of typical like what we're sort of saying about the acute lower back pain. So where it's I often people describe it to me as either it's the back has flared up or that that it's gone. Like they quite often will say that to me that their back has gone, and it's that really painful sometimes it's sort of that stiffening or like the spasming type sensation. Sometimes you get the neural sort of referral down the leg, so you're feeling it either into the glutes, sometimes it's all the way down into the feet, so you're getting that pins and needles and numbness. Sometimes it's a case of like there is that real lack of movement in the body, so you're struggling to either sit, lie down, stand. Sometimes it's a case of that even having any comfortable position is quite difficult. And I often find with clients that come in with that, if it's not something they've experienced before or haven't experienced it very regularly, then there's quite a lot of fear around with that sort of one as well. So that adds to the sort of heightened sort of sensitivity of everything. There's a lot with a lot of fear of not thinking that there's something really wrong. And then the other sort of more just specific sort of like general sort of lower back pain, which I often find people describe either more one-sided or it's a lot more sort of like there's that deep dull ache that's a bit more constant that people will find. So that's kind of the sort of the two categories I would go with that I tend to sort of see and what people sort of say and how they're explaining it. With regards to how and what I do, actually, I was just saying to you, wasn't I? I don't do an awful lot that's different. Like the main thing I find, as long as with the back that we kind of screen out the red flags, so that's the key thing with the backside of stuff first, is to rule those things out. But obviously Caroline and myself or whoever else you see will take you through those sorts of things to rule that side of things out. But the main things is obviously making sure like bowel and bladder and things like that are okay, and that there's no like numbness around that sort of saddle area. They're the main ones to look out for when it comes to back pain. But generally what I find, if you're getting pain in the back, as a general rule of thumb, that it's not usually then something too sinister. Normally if there's a problem with disc nerves and things like this, the pain isn't usually felt at the back, it's normally downstream that the issues become. So if you've got something in the back, that's one of the first things I try and reassure people is I'm like, well, if you're feeling it there, chances are it's probably more on the muscular and soft tissue side of things, just because of where you're experiencing the sensation. So that's one thing. And then in terms of the sort of like with back and stuff, like I generally find But regardless of whether it's the acute lower back spasm or whether it is just lower back pain, that the thing that I recommend people the most is to get the movement through it, because quite often people will be like, I did nothing, I sat still, or I don't move, or I stayed in bed and things. And actually that can be sometimes the worst thing to do for the back, because it doesn't like it. It prefers to have a bit of movement. It likes a bit of loading. But the key with it is finding how much and what movement to kind of work with. So especially going to like the acute lower back pain, I often find that stuff to kind of calm that neural response, because one of the ways I try and help explain it, especially if someone's quite fearful of it, is thinking of the back pain as a bit like a child having a temper tantrum. So say that for whatever reason you've got that heightened sensitivity into the back, so whether it's being like you've done something novel, so say for example you've done some DIY, or you've done a bit of extra training that you don't normally do, you've done a different type of training that you don't normally do, you've done less training than you normally do, and then have suddenly sat for hours, and then or done something like reach down to pick up something off the floor, like these weird things, but then there's been this really big stress building up to this time you've relaxed and stuff like this. There's a load of like factors outside that can lead into why that things can be a bit tighter or sort of sensitized, or it could just be it's just one of those things. Like that is also quite common with the back. It's just no rhyme and reason, it's just what happened. But going back to the analogy is the fact that it then flares off. So like if a child's having a temper tantrum, there's chances are they might be hungry, they could be tired, there's all these other factors that why they might be like that, or they're just in a bad mood, like it just goes. And they'll kick off. And then I find that what a lot of the time there's sort of the two approaches. People either try to ignore it and push through it, and then it screams like the back pain gets more intense, and that's where you get the sort of spasm type response. You might get referrals down the legs and things like this because you're ignoring it and pushing through it. Or people get fearful of it and are then trying to be like, why aren't you doing this? Like, I don't know what to do and stuff. Which when you're dealing with a child in a similar state, that neither approach really works. They do just tend to shout and scream and kick off. And so with the back pain, like using that is a way of just trying to calm. You want to kind of be like, right, there, like what's wrong? And you sort of try and work with it. So you're trying to calm down that nervous system, whether it be with massage, maybe it's breath, maybe it's like gentle movements. I often find like cat-cow is a really useful movement, because you can control how much tilting you can do. And if it is like, even if being on all fours is difficult, you can do it laying on your back, so then you're not even in gravity. Like it can be, I find that's quite a safe position the body likes to be in. So it helps that you sort of calm it down. But then I always talk about that it goes through sort of stages, because just like a child having the temper tantrum, it doesn't suddenly stop. Like it will come down to what I refer to as the wobbly lip stage. So once you've calmed down that sort of spasm response of the lower back pain, then you go into that stage of where you sort of still can feel it, but it's okay. And it's that sort of, people often describe it as that sense of like, oh, if I do something, it might go again. And it's the wobbly lip stage, where you still want to keep it calm, but you also want to distract with other movements. So whether it be other types of stretches, whether it is walking and lighter loads of your training, if that's still possible, or other forms of training, if it is sort of things that are aggravating. And so you're just introducing that little bit of movement, essentially teaching it and sort of showing that it's okay, you can calm down, like there's nothing to worry about, there's no stresses and stuff. And then once you kind of through that point, that's the point that then it generally tends to be that everyone's moving a bit better and things like this. Whereas with the like normal, like non-specific lower back pain, or less acute, then I find that generally where you'll pick up is you don't need to do so much of the calming down side of stuff, and it is more just about the introducing the different movements, showing that you can do this type of thing. Or I often find the massage technique where you do like your soft tissue release, so you're sort of targeting the area and then stretching, and so it's that movement and targeted stretch works really well for targeting the sort of the soft tissue around there. And I also often find looking at like other areas, so looking at hip mobility, looking at sort of like if there's any tension or tone in the glutes, hamstrings, quads, and looking at these muscle groups and doing targeted mobility. Or you might even find that's where obviously strength stuff might be useful, because it might be looking at what like the tone in the back is, because the back's actually doing the work and something isn't.
Yes,
so it's the
exactly.
sensations and stuff. So but they all kind of follow that like journey. So someone that I see with the acute lower back pain, it could well be that we end up doing the same at the end as what someone coming in with the sort of more generalized lower back pain is, but they're just a bit further along and stuff.
Yeah, no, totally agree. And like you say, kind of coming into talking a bit more about movement, and a lot of the time when I'm working with people and we're talking about, lower back, either, it can be acute pain that is perhaps caused by trapped nerves due to really tight muscles in certain areas, or it could just be a general, I have lower back ache. Obviously, like you were talking about, first of all, the process of getting to know a person, perhaps what their activities are, what they do. Often when people have sedentary jobs where they're sitting for long periods of time during a day, what other things are going on in their lifestyle, how much sleep are they getting, how stressed are they, all those things that kind of contribute. It's I find with back pain, it can be quite holistic really, in terms of what we need to as clinicians take on board with that individual. Lots of the advice that we might give might be very similar, but obviously we need to make sure we've got a really good background on what's going on with that person and how they spend their days, to make sure that we're giving kind of more personalized advice for them specifically. And some of the things that I focus on the most, obviously, are perhaps strengthening certain areas and mobility. Now, like you said, with the strengthening side of things, often it's not actually the back muscles that need strengthening. Those are actually pretty strong. What has happened a lot of the time is they've used some of their back muscles as prime movers, prime stabilizers for whatever they're doing, and actually they need to strengthen other areas which are going to take that element away. So obviously the stronger you build other areas, so it might be hip flexors, for example, or glutes. We talked about even going down that kinetic chain right down the back of the legs, kind of could be hamstrings even. Talking about stabilizer muscles in terms of abductors, adductors maybe. It could be any of those areas, which obviously, I would do testing for and kind of test out a strength, but also stability through certain movement patterns to see where the weaknesses lie. Because then as soon as you kind of strengthen those areas and understand how to activate those other muscles once you've built the strength in those areas, then you'll naturally start to take away from some of those other stronger muscles, like your lower back muscles in particular, and maybe your erector muscles either side of your spine. And as soon as you start doing that and taking the load away from those lower back muscles, you're going to release so much of that tension, the contraction of those muscles being used all the time excessively, compared to actually then activating other muscles which can take more of the load. So that's definitely one of the things that I look into detail with people. But like you said, also mobility. Now, what lots of people come to me with, particularly those people who do have sedentary jobs, they're sat in a chair for long periods of the day. Sometimes they'll get issues through shoulders as well. So they'll be like, oh, well, I stretch like this, or even things like I have a standing desk, so I will stand up part of the time, or I'll sit down part of the time. And I think that idea is good, because obviously when you go from seated to standing, what you're doing is you're changing your hip position, which can be part of it. And also things like when people get really tight piriformis underneath your glutes, that can often be tight because again, you're in that sat down kind of position for long periods of time. So if you can release it by standing, seated, walking around, going to do other things throughout your day, that's going to obviously benefit that. But the one thing I find that people haven't considered too much, whether it's they're working standing or seated, is spinal movement. So
Yes.
they do not consider the fact that your spine can move in more than kind of one way. Most of us think about our spine being able to kind of flex and extend. So you've got that flexion and extension movement, which is often, if I kind of turn sideways, most people think about it as I can lean forwards, I can bend it forwards. You can go as far down as touching your toes, of course, and then you can extend by pushing your chest out, getting that curve in your lumbar spine. and they will kind of stretch out like that. And that does feel good, because obviously you're releasing from the position that you might be sitting in a bit more slumped like that, possibly for the majority of the day, and then releasing those muscles. That will feel good, and that will help a release. But that's only one way in which your spine can move, and will release different muscles that support your spine, and release other muscles in that lower back as well. So the other kind of two ways I get people to think, and they can do it from seated, just there again, if they feel really can't get out of their seat whilst they're working, they can do it from seated, or they can obviously stand up and do this when they're moving around, rather than just thinking about standing up and moving in this forward kind of plane where you're just kind of moving forwards, moving backwards, but not moving side to side, for example. So one of the things I like to do is get people to think about your spine being able to rotate, and move muscles that kind of help with that rotation. And one of the other little tips I like people to do, so that they don't cause themselves any other neck injuries and crick their neck if they're doing some sort of rotation, which I know some people will do if they go too far, is to actually put your arms up in front of you like this. So I get them to put the elbows up at shoulder height, and then look down the corner of that elbow as you rotate, but don't take your eyes off of that, because if you go even further with your neck, that's where you might possibly, if you've got tight shoulders as well, might be trapping a nerve through the neck or through the shoulders. So I get them to have a little look at the corner of that elbow, and then they're going to keep their feet flat on the floor, and then they're going to rotate from the waist. Watch that elbow, don't go further with the head, go as far as you can, have a little pause there, and then just kind of rotate it through. Watch the other elbow, and then go round and get a nice rotation through there. So I can already feel, as I do that, I can feel my lats moving around. I've got kind of rhomboids through the more kind of in the upper back shoulder area, kind of all kind of moving, contracting, loosening, and that's a really nice way to kind of loosen muscles kind of through the mid back. And then obviously you can go through your going into that lower back as well. Obviously your spine, you know, you will kind of be releasing all sorts of muscles and movements doing that, but also your lateral side to side. So reach downwards, you know, your hand down towards your knees, towards your ankles, and don't lean forwards, don't kind of necessarily lean back, just literally go side to side. You've got that lateral movement, and again, I can feel different muscles releasing, moving. And I really, you know, what I try to get across to people is it's not just about movement. People are very stuck, I think, in thinking that with back pain, it's often because they just don't move enough. They don't get up enough out of their seat. It is really about diversity of movement, not just movement, because you can move just in one way. As I say, you could get up and say, well, I get up out of my seat, I go and make a cup of tea, I go to the toilet, I'm moving, but they're moving in this forward backwards position, that frontal plane, the majority of the time, and not giving their body that diversity of movement. And it's not just the rotations, the lateral side to side movements, it's also thinking about the up down movements as well. You're getting yourself into positions where you can kind of, you know, even just doing a few squats, for example, or a few lunges as well, which will put you into different positions with your hips, which will be really great for releasing muscles through the lower back and through the hip flexors. You know, just doing diversity of movement. What I call to my clients, I always say they're like little exercise snacks throughout your working day. 30 seconds at a time is all you need to do, but do it consistently and do it just regularly throughout your day. Just kind of, it's one of those healthy habits which, if anyone, you know, particularly suffering with lower back pain, or any, you know, sometimes even shoulder pain as well, like when you've got really tightness across your shoulders because you're sat down at your desk for long periods of the day, if there's any kind of New Year's resolution, if you dare put one of those kind of things in place for the new year, or just a, you know, a New Year's habit, it is to just make sure that if you have a sedentary job in particular, that you think about diversity of movement throughout your day. Little exercise snacks as often as you can, and make that one of your newest best habits that you carry through for the rest of the year. Because if you are someone who suffers with as I say, even kind of shoulder achiness, neck achiness, neck problems, lower back problems and soreness, pain through your hips, that kind of thing, just little exercise snacks, diversity of movement across your day is honestly works wonders if you stick to it, and it doesn't take much effort. It's just more about the habitual something that I do as part of my daily routine. You know, even if you have to start by setting a timer on your phone for every 20 to 30 minutes throughout your day to start with, to get you in that mindset of every time I don't have to be kind of sat here intensely doing something, that I just move slightly for 30 seconds in a different way to the time I did it before, then I do find that so many people have massive benefits from that. And every time I, suggest it to a client to start doing regularly, and they start doing it literally within a few weeks, they're emailing me, telling me what a difference it's made, how much of that ache has disappeared, that they just feel generally better, they can move better, their mobility is better. Other aches and pains sometimes start to disappear and go away as well. So I just think diversity of movement, if you can remember that as a kind of a key top tip really throughout this conversation, that's what I'd love people to take away with them.
Yeah, definitely. I was one thing I was going to say with what you were saying with the diversity of movement, especially for the back. The other bit I find on it that I think is helpful is, like you say, with the different, not just the lateral rotation and the rotation, but also remembering that it moves in sections. So as well as the, like, not just literally I'm bending sideways, like it can move as lower back, mid back, upper back. So when you're taking the rotation and stuff, like take that time to kind of almost like feel that sort of like rotation occur through the different levels, because I often find with back pain that it moves as one big like bonk bonk and stuff, which if you've lost that mobility through each level of the spine, that can be really good if you're just, again, just sort of like, even when you're sat at the desk, like when you're going to sit up tall, is just think about that sort of like unraveling or curling down. And then the same with like what you're saying with the rotation is like that gentle turn or the side bending. Again, that I often find a cueing with side bending of that like lifting up, and then because it gives you that sort of space to open up and then stretch out through the different levels, a bit like a slinky bending. That's what I tend to find is quite useful for that, because it just, again, it gives you that bit more like movement through, and that sort of fluidity that often gets lost when backs get stiff.
No, I agree. And actually it makes me think it's very similar to how I would talk to clients about mind muscle connection, and trying to really isolate, when you're working on a particular area of your body, you're trying to build muscle in a certain area. Similarly, like you say, be mindful of trying to isolate certain sections of your back when you're doing those kind of movements. That's a really good point. I think kind of that specific of trying to think about specific areas of isolating the back and the spine is really good, and trying, like you say, that will help kind of decompress certain areas that obviously do kind of compress throughout our day, particularly as we know in the lumbar spine there, we get that most compression when we're just sitting in a certain position, so it's a really good way to be able to do that. And obviously, as I say, you can do it seated, you can do it standing, it doesn't matter. Do it differently throughout your day, and just make sure you get that diversity of movement really. So really good. Okay, lovely job. Well, I think all we need to do is wish everyone a Merry Christmas, and we'll see you in the new year, ready for some perhaps exciting new chats, and also we'll go back to talking about, New Year's goals, where we're at. We'll come back to some of those conversations we've had already in terms of helping people to move forward and set new goals, which are going to be really sustainable in the new year. Okay, right. Nice to see you again, Imogen. Have a lovely Christmas and New Year, and we shall be back soon. Take care, everyone.